This year's Youth Month theme is Youth Power, growing South Africa together in the period of COVID-19. And this year's commemoration is being overshadowed by challenges brought by the pandemic. One of these major challenges is mental health, which has been flagged by the United Nations as a concern because it can lead to more serious issues. Now, joining us to expand on this discussion is Masutane Modjadji, a project leader from the South African Federation for Mental Health. A very good morning to you, and thank you so much for your time. Mental health is one topic that is mostly really ignored because the health challenges are so prevalent among young people, yet some of the cases go about undiagnosed and people not really being aware of how they're feeling and how it's affecting their day-to-day life. When it comes to analyzing the impact of mental health on young people, exactly how severe is it?
So you are right, Mpo. First, let me just say good morning to you and the viewers of Newzroom Afrika. This year's Youth Month celebration comes at a time when the world's attention is on the global pandemic, and that experts have warned us that it's going to have sweeping challenges on the mental health of the population, and this includes the youth, who are among those who are severely impacted by the pandemic. Even before the pandemic, mental health challenges were already a prevalent issue among young people. But I mean, you get negative perceptions about mental health that often lead to stigma and discrimination. And this also just prevents people from seeking help. So it is, in terms of the estimation, it's estimated that half of mental health conditions developed by the time a person is the age of 14, with a quarter of these developing when the population is in their mid-20s. And in severe cases, we know that mental health illness can lead to suicide. And tragically, suicide is the second leading cause of death among young people between the ages of 15 and 29 years. And what makes mental health even a great challenge among youth is the fact that there's lack of youth-friendly information on mental health. And this is also despite the United Nations, which you have mentioned before, saying that mental health conditions such as depression, anxiety disorder, and disruptive behavioral disorders have a significant impact on the development of 1 billion youth across the globe.
As you speak to youth-friendly information and you touch very briefly there on some of the conditions that fall under mental health, depression, anxiety, how does one become aware that they are indeed suffering from such mental health issues and then begin to seek help?
So mental health illnesses manifest in different ways. I mean, you get the depression, you get stress disorders, you get anxiety disorders, all which are just psychosocial challenges. And it's really hard for a person to really just self-diagnose. But if you notice that you have anxiety and stress, it's always good to speak to a professional. And as a federation, we always get information about people who are unsure whether they have a mental illness or not. We always just refer them to a specialist. So it would be good to speak to someone if you're really unsure about what you're feeling, and if you really want to get to the bottom of maybe you're experiencing depression, stress, disorders, or anxiety, to just speak to someone who can then refer you. And as a federation, we also have, we realize that there's no youth-friendly information that young people can access. So we have a youth-dedicated website, which is called the my-mh, which is like really just an abbreviation for mentalhealth.org, which provides young people with a repository of fact sheets and infographics and news items surrounding mental health, tailored specifically for the need of young people. And during this state of national disaster, we've also just partnered with organizations that really just target youth, including higher learning institutions, where we've developed digital tools to help young people with information that will help them to actually just cope during the current pandemic, and actually just has contact details of places where they can find help should they need to speak to someone.
As you speak about access to information, access to youth-friendly information, there often lies barriers for one to even get the access, stigma and discrimination. What role do these two elements play before one can actually access the information?
Stigma and discrimination are a great challenge in accessing health, public health in general. So it's even more of a challenge when you're trying to access mental health services, because of also just the perceptions around mental illnesses as well. So this plays a huge role. And also in terms of, like you mentioned about accessing information in South Africa, we also have challenges of youth accessing even websites that I'm speaking about, because of data and connectivity issues. So it's always just a challenge that, layer after layer of challenges that young people face. So we also try to share some of these tools and information on our social media, that we believe that even if people are not able to access, they can maybe somebody can share it with them. In terms of stigma, we know that it prevents a lot of people from looking for help. But in South Africa, we also have a challenge of health resources. According to the World Health Organization's Mental Health Atlas of 2017, we don't even have a lot of personnel to assist with mental health with mental health in our public sector. So it becomes even a challenge. And the data from the United Nations shows that around 76 to 85% of people in countries like ours do not even get the assistance that they need if they have mental health challenges, because of the lack of resources, as I've spoken about.
Thank you so much for your time, Masutane Modjadji, the project leader on info and awareness at SAFMH, giving us a sense there of the tools that are available to ensure and assist those who may be dealing with mental health issues, and of course making them aware that the condition is indeed there.